Hello, welcome everyone. We're going to give everyone a chance to filter into the conversation, so we'll be starting in a few minutes. Welcome all to our community conversation about women's heart health. We are so glad you have joined us to engage in this important topic. I'm Danielle Little, influencer and blogger from thecubiclechick.com, and I am excited to be your moderator today. Can I just get us chatting for a moment? You'll notice that there is a chat feature here. Please share with us in the chat box something about yourself. It can be as simple as where you're joining us from, or you could share why you've decided to join us today. Remember to select all presenters and attendees in the drop-down so everyone can see your responses. We'd like you to keep them coming, and we want this event to be interactive, and we want to hear from you throughout the presentation. We appreciate you for adding your voice. Cardiovascular disease, CVD, is the #1 killer of women. It claims more lives than all forms of cancer combined. Women, typically Black women and Hispanic women, are disproportionately impacted by heart disease and stroke. And research shows heart attacks are on the rise in younger women as well. Pregnancy-related deaths in the US are also rising at an alarming rate, and cardiovascular disease is the leading cause. Between 1987 and 2015, pregnancy-related deaths rose from 7.2 per 100,000 live births to 17.2 per 100,000 live births. Yet younger generations of women, Gen Z and millennials, are less likely to be aware of their greatest heart health threat, including knowing the warning signs of heart attacks and strokes. That's why it's important for all women to take charge of their health and encourage others to do so as well. Losing even one woman to cardiovascular disease is too many. I want to be sure to thank our sponsor today, BJC Healthcare, and all of our experts and participants, and for your work to elevate health in our community every single day. And hello, Nina. I see that you're working from home. Thank you for joining us. And Mandy, you're listening from St. Louis, and we are so happy to have you here with us. I'm going to introduce you to our panel today. I'm thrilled to introduce you to Dr. Caitlin S. Rodgers. She is a BJC Medical Group primary care physician. Dr. Rodgers is a BJC Medical Group primary care physician and obstetrics specialist at Progress West Hospital. Dr. Rodgers provides comprehensive preventative care, including annual wellness exams and immunizations, as well as care for chronic conditions such as diabetes, high blood pressure, and asthma. Thank you for joining us today, Dr. Rodgers.
Thank you, Danielle. I'm happy to be here. So like she said, my name is Caitlin Rodgers. I'm a family practice physician out here in O'Fallon, Missouri, with BJC. And one of the fun parts about my job is simply the fact that I'm family practice. And so I am a little more of a, I guess, traditionally trained family practice doctor in that I see all ages, birth to death. And that's a great thing for me because I get to know whole families. I get to provide lots of continuity of care. But looking at like today's topic in particular, it also helps me to do the best job I can in being the first line of defense when it comes to heart disease. And so I want my kids, my adults, my elderly coming in here and seeing me every year so that we can start that preventative care early. And then as things do come up, we can make sure that they're treated appropriately and get our specialists on board, such as our cardiologists and our maternal fetal medicine specialists, et cetera. So things I always stress is even if you are totally healthy, come and see me at least once a year. We want to check your blood pressure. We want to talk about nutrition and exercise. We want to make sure you're maintaining a healthy weight. True preventative care before anything ever happens, and ideally nothing will happen or come up. And part of that is staying on top of it from an early age. So even with my kids that come in, you know, we may not be directly using the terms hypertension or high blood pressure or things like that, but we're going to be introducing healthy topics along the way, like making sure people are staying physically active and you know, for my kids, always asking, are you eating your vegetables, and talking about processed foods and salt content and things like that. And then as people get older, we want to be mindful of, you know, not only their personal risk factors, but family risk factors as well. And then as they come in, for females in particular, looking for any sort of symptoms that would warrant a further workup of their heart. And females sometimes can present a little bit differently than males. And so we need to be mindful of that. The other thing that I'm really, really big on, so like she said, I do obstetrics as well. So I manage, you know, low to moderate risk deliveries. And even if I'm not a person's OB, I want to make sure that they have optimized their health as much as possible before they ever even think about becoming pregnant. So some major risk factors with pregnancy can be obesity and high blood pressure, and that increases your risk of heart disease in the long run. So we want to make sure that that is, you know, taken care of as best as possible before somebody becomes pregnant. And so my goal as the primary care physician is, again, to keep an eye on a person's weight, to check their blood pressure, to manage their chronic diseases as best as possible. And then also really to make sure that they're on medications that would be safe in the setting of pregnancy. There's a lot of medications that we use with high blood pressure and heart disease and things like that, that we may adjust a little bit in the setting of pregnancy. And so if I know somebody's planning on becoming pregnant, I may start making those transitions early so that they're as ready as possible and as safe as possible from that standpoint. So yeah, I mean, preventative care is kind of like my bread and butter. I love seeing young patients so that we can stay on top of things. But then as things do come up along the way, we want to make sure that we're that first line of defense so that I can get you to the cardiologist and the specialist when that time comes appropriate. So again, thanks for having me today. And I'm happy to answer any questions along the way.
Thank you so much for being here with us today. We truly appreciate it. I also want to recognize Kimberly. She is tuning in from St. Genevieve, Missouri, and her message to everyone is stay strong and well, ladies, and I could not agree more. Our next physician on our panel is Dr. Catherine Lindley, MD, Washington University Adult Congenital Heart Disease Specialist. Dr. Lindsay is as I said, is a Washington University adult congenital heart disease specialist who established a women in heart disease program at Barnes-Jewish Hospital and focuses on treating several key cardiology issues, including heart disease and pregnancy. Thank you for joining us today.
Hi, thanks so much for having us, Danielle. So I am a specialist in women's cardiovascular disease. And I do also specialize in taking care of adults with congenital heart disease. So about 8 years ago, we established the Center for Women's Heart Disease at Barnes-Jewish Hospital and Washington University Center for Women, or Washington University School of Medicine. And really what we aim to do is to really take care of women's heart health with really sort of women-specific expertise, beginning from adolescence all the way through the end of life and geriatric time period. And that the reasons for that are because, as Danielle mentioned earlier, cardiovascular disease really is the leading cause of death in women. And it's also the leading cause of maternal major complications and death of pregnant and postpartum women. There are a very rapidly growing number of young women, women of childbearing age, who now have both acquired, meaning heart disease that you develop as you become older, as well as congenital or heart disease that you were born with, conditions, who are, still of the age where they may become pregnant or may desire to become pregnant. And this is for a few different reasons. Our pediatric cardiologists and pediatric surgeons are doing amazing work, and those kiddos born with heart conditions are now growing up to be healthy adults. And so we're now taking care of them into older adult years. And also, just because of trends that we're seeing in the United States with increasing rates of overweight and obesity and higher rates of diabetes and high blood pressure, many more young women are now developing cardiovascular disease, whereas we used to see that in much older patients. So we're now having women who are in their 20s, 30s, and 40s who may have heart conditions like heart failure or heart attacks that we normally would have previously maybe seen when women were in their 50s or 60s. So at our center, we really take a very multidisciplinary approach. So we basically get all experts on board and put our heads together to make sure we can work together to take really good care of patients, whether that's before pregnancy and thinking about how to safely plan a pregnancy, throughout the course of a higher risk pregnancy, or after pregnancy through menopause and into kind of the grandma years. And we really try to think specifically about what conditions kind of disproportionately affect women, what types of risk factors do women have related to hormones, related to pregnancy, related to menopause, related to conditions that affect women like autoimmune disorders, so that we can think about how all those conditions may cause heart disease to show up differently in women, or may cause them to have different symptoms, or may affect their life differently. And so while women are at risk of getting all the same conditions that men are, there are certain disorders that are more rare in men that we see more frequently in women, or that come up at different time periods in their life that we're really tuned into, so that we can really provide kind of women-specific care.
Thank you so much again for joining us today, and we're looking forward to getting even more information from you. Let's see, we have Erin joining us also from Waterloo, Illinois. She says she was born with, and I cannot pronounce this, is it
Triatriatum.
Yes, thank you for helping me with that. Thank you. And is currently experiencing having her first baby. So thank you for attending with us today. Next on our panel, we have Dr. Jeannie C. Kelly. Dr. Kelly is a Washington University maternal fetal medicine specialist at Barnes Jewish Hospital. She cares for families with high-risk pregnancies, including women with congenital or acquired heart disease who are pregnant or contemplating pregnancy. Thank you so much for joining us today, Dr. Kelly.
Thank you so much for having me, Danielle. And I echo everything that Dr. Rodgers and Dr. Lindley has already so eloquently stated. I am a high-risk obstetrician. So what I do is I specifically take care of pregnancies that have other complications going on. Those complications can be from mom. So mom could have other medical conditions like diabetes, high blood pressure, congenital heart disease is one of those, or other kind of, concurrent medical conditions that complicate the pregnancy. And I also take care of pregnancies that are complicated because of fetal issues. So preterm labor, preterm birth, growth restriction, or birth defects. I think in our current society and the way that we think about pregnancy is that it's really, we kind of think of it as this like isolated special time that we really want to, pinpoint and think about, and how do we make these outcomes for all these pregnant mamas the best that they can be. And I really think that is a disservice to pregnant women and infants in general. Pregnancy is really one snapshot of a time point in a woman's life. And what is really going to impact how that pregnancy goes is what her level of health was coming into that pregnancy. Certainly the care that she gets during that pregnancy impacts it. But also how she comes into that pregnancy is as important, if not more important. I see pregnant moms for 30 weeks of prenatal care. And that's really all the time that I have to try to optimize that mom's health for the health of herself and for her fetus. But really that journey starts as soon as someone is born and contemplating pregnancy for the future. And that's why our partnerships with Dr. Rodgers, with family medicine, Dr. Lindley with cardiovascular health is so important, because if we're already way behind the ball when someone becomes pregnant, my job and all of our jobs during that pregnancy is really hard to try to roll back and undo and kind of optimize all of this health that hasn't been addressed for many years. And I also think I appreciate Danielle pointing out the disparities that exist, because we know that access to medical care is very limited in some states. Here in Missouri, we are not a Medicaid expanded state. And so pregnant women preferentially get access to health insurance while they're pregnant, but that isn't the case outside of pregnancy. And so many times I see patients who have chronic health conditions, but have not been able to make it to the doctor for many, many years, if not decades sometimes, before they become pregnant. And we are so far beyond the ball at that point to try to optimize her health and her baby's health that it's really an uphill battle. So if there's anything that I think all three of us are saying in conjunction in terms of really making sure that mom and baby are as healthy as possible for pregnancy, it's really to make sure that outside of pregnancy, even before you're thinking about becoming pregnant, that cardiovascular health and heart health are already being monitored, addressed, and that we are all doing our best to try to take part in preventative and primary care first and foremost. During pregnancies, there are very common, so as Dr. Lindley said, cardiovascular disease is the #1 cause of maternal mortality in this country and everywhere. And that encompasses a large proportion of problems. We think of cardiovascular disease and we think of things like heart attacks, but it also includes things like high blood pressure, preeclampsia, which is a high blood pressure disease specific to pregnancy, heart failure, and strokes. These are all kind of a spectrum of severity of the same disease. So I'm happy to be here, and Dr. Lindley and I, and actually Dr. Rodgers and us, we all share patients together during their pregnancy journeys. And our goal is always healthy mom equals healthy baby. And we need to make sure that both of them are taken care of for a good outcome for both.
Thank you so much again for joining us today. And I mean, as someone who I had my children quite a while ago, I have a 27 and 17-year-old. I will tell you that I had a high risk pregnancy the second time, and just the care and concern that my physician showed is still with me today. And like when I look for certain care, doctors for other things or for my daughter, I'm always looking for that compassionate piece. And all three of you display that. And it's really, really important. So thank you for that. So we have some questions that came in before the call, and we would love to start having you guys answer. And of course, if you're attending and you're a participant, you can put your questions in the chat box and we will make sure that it is addressed during the conversation. So don't be shy. Go ahead and add those questions in. So Dr. Rodgers, I have a question that was sent in before. How important is it for women to have a primary care doctor?
Absolutely. It is extremely important to have a primary care doctor. I have a lot of gals who come in and there may have been a 10, 20 year gap in their primary care, and that's okay. The most important thing is that they're coming in right now. But the ideal situation is to have a nice continuity of care from the pediatric realm as you age out of that. And like I said, even if you're completely healthy, still coming in to see me every year so that we can truly work on chronic disease prevention. And that, after you age out of that pediatric realm, we're getting into those prime childbearing years too. And those are things like we've said over and over today that are extremely important. And so whenever I sit down with my patients and talk about preventive care, we're going to touch on a lot of different things, regardless of what age you are. And there are things to be mindful of as you get older and things you can do to really optimize your health. And so those are going to be things, we're going to check your blood pressure and your weight at every visit. And weight's obviously a sensitive topic, but we find creative and constructive ways to approach this because it really can be a benefit for your health in numerous perspectives in the long run. We want to talk about nutrition. We want to talk about physical activity. And then we just want to talk about overall how you're feeling, not only from a physical perspective, but from a mental health perspective. From a primary care standpoint, in my opinion, physical and mental health are completely interconnected. And so I always try to touch on that too, because that has a huge impact on someone's physical health as well. Mental health has a huge impact on pregnancies. And so these are always things that we need to be mindful of. And we're going to have that conversation every time you come and see me for a preventative visit. And then when it comes to preparing for those childbearing years, like we've alluded to, we want to make sure that you're in the best health possible leading up to that, as opposed to waiting until you become pregnant and trying to fix everything then. And so there's lots of conversations to have along the way to prepare for a nice, safe, and healthy pregnancy. From that same perspective, there's a lot of things that primary care will follow up on after a pregnancy. So for example, if you had gestational diabetes during your pregnancy, you're at increased risk of type 2 diabetes in the long run, which therefore increases your risk of heart disease in the long run. So there's kind of this chain reaction that takes place. And by touching base with your primary care doc every year, we have a chance to talk about all of that and have those conversations. And then if anything does come up along the way where we need cardiology or we need maternal fetal medicine or we need whatever specialist, we are up to date on everything. We have everything ready to go, and then we can get them on board to help us out.
Thank you so much for answering. And again, I want to applaud you guys, when you talked about the weight, and it's a sensitive topic, the fact that you keep that in mind and you make it palatable for the person that's experiencing it and going through treatment, I think is really important. So Dr. Lindley, when should women start to be concerned about their heart health?
I think it's really never too early to start thinking about your heart health. Even at a young age, women can begin to develop sort of precursors to cardiovascular disease that don't have any symptoms. So the vast majority of the time, high blood pressure is asymptomatic. So, and we know that a pretty substantial, minority of young women going into pregnancy actually already have high blood pressure. And you will not know this if you don't go see your primary care doctor and get your blood pressure checked. So it is, as Dr. Rodgers has been saying, super important to go check in every single year to get that blood pressure checked, to begin screening from a very young age to evaluate for high blood pressure. It's also really important to have other routine screening performed, such as screening for high cholesterol. So high cholesterol is another condition that will have no symptoms whatsoever. And there are in particular types of genetic varieties of high cholesterol that even if you are a very active athlete who is very thin and is asymptomatic, you can still have extremely high cholesterol. And if that's not diagnosed and treated at a young age, that can lead to really premature heart disease. So it's really recommended that all patients beginning at age 21 have their cholesterol screened and then have that screened at least every 5 years thereafter. And there are also recommendations for routine screening for diabetes for certain patients, depending on what their risk factors are as well. And once again, unless the blood sugar is extremely elevated, that oftentimes will be asymptomatic. So just getting in and having all those risk factors screened for can be really important to help prevent the long-term damage from those asymptomatic risk factors. The other important things I think in particular for women to think about are the development of cardiovascular disease around times of hormonal changes. So for example, during pregnancy is a time when women are at increased risk of cardiovascular complications. And that most commonly occurs actually in the postpartum period and that early postpartum period. And that's a time when, I know several of us on here have kiddos. You get home and you're like just relieved to not be pregnant anymore. And you're so enamored with your baby that the last thing you're thinking about is your heart health. But it's actually a really important time to be thinking about your heart health because it's the most common time for heart complications like heart failure and strokes and even commonly blood pressure complications to occur. And so it's a time when it's still really important to pay attention to the symptoms you're having. And if something just doesn't seem right, you should call your OB doctor. And then the other really important time to start to key into all of those risk factors and symptoms would be around the time of menopause. We know that around the time of menopause, even before you go through menopause, but as you're starting to approach it, all those cardiovascular risk factors really start to increase. So blood pressure tends to go up, blood sugar goes up, weight goes up, cholesterol goes up. And as all those risk factors go up, the risk for developing cardiovascular complications like heart attacks and strokes and heart failure start to go up as well.
Thank you. That's really good information. And it's something that I'm definitely going to share with my audience, like that you should always be cognizant of your heart health and always ask those type of questions when you do get your physical checkup. We actually have a question from our audience. Amy wants to know, should women have both a PCP and an OB? And each of you can, anyone can answer that for Amy.
I can go ahead and take that one. Short answer is yes. It is important to have both for all the reasons we just talked about. There is a couple ways you can go about this. You can have a primary care doc, whether that's family medicine or internal medicine, and an OBGYN. That's fantastic. There are some primary care physicians out there, such as myself, that do routine pap smears and things like that. Now, your primary care docs who do those, we're not surgeons, so we do have a limit of gynecologic care. But in terms of just routine pap smears and screenings, a lot of us do help with those as well. So it is important to address both components, regardless of whether you do that with just your primary care doc or whether you utilize an OBGYN as well. I tell my patients I have absolutely no preference which way you go about it, as long as you're addressing both the primary care side of things and the women's health side of things with somebody.
I couldn't agree more. I think we're just all part of a team and we all just offer different expertise. I see a lot of patients as a cardiologist to manage their blood pressure and cholesterol, whereas a lot of primary doctors manage blood pressure and cholesterol. But some of those patients who I manage those issues on have a lot of other chronic issues. And so there's a lot that their primary doctor's managing. And so, there's only so much you can pack into a 15-minute appointment. So their primary doctors, may be managing their diabetes and their lung disease. And I'm kind of taking care of the cardiovascular risk factors. So I think it's just important to tag team, but you definitely need a primary who's really focused in on that sort of medicine side of things. And then somebody who's also paying attention to the gynecologic side of things.
Great. Thank you so much. Dr. Lindley, what can women do to lower their risk for developing heart disease?
Well, as we've all been kind of talking about, staying in regular touch with a doctor, a primary care doctor, is exceptionally important so that you can get all of that routine screening done. And then certainly if any abnormalities are identified there, you want to have that blood sugar, the blood cholesterol, and the blood pressure very well controlled. Routine exercise is exceptionally important. And I always tell people, even if you're exercising and you're frustrated because your weight's not going down, don't feel like you're not accomplishing anything. You are actually accomplishing a lot, even if the weight isn't moving, because that exercise still gives you benefit in terms of your overall cardiovascular risk. It still improves your blood pressure. It still improves your cholesterol, and it still improves your blood sugars. So obviously it's a very nice benefit of exercise to lose weight, but even if you don't lose weight with exercise, you're still getting a lot of benefit. Really healthy dietary habits. So lean meats, low fat dairy, try to avoid sugars like sugar sweetened beverages and excessive fats, lots of fruits and vegetables. That's exceptionally important. And then the absolute most important thing you can do is to not smoke. So if you're already smoking, try really hard to stop smoking. And if you don't smoke, don't start. I know it's exceptionally addictive and it's really hard to stop, but if you've got the willpower, then there is a way. You just have to keep at it. And if you fall off the horse, just get back up on and try again.
Very good tips. Thank you. Does anybody else want to weigh in on this conversation of how to stop heart disease before it starts, or cardiovascular disease? Okay, Dr. Kelly, I have a question for you that was asked before. Some women only go to the doctor once a year for their annual visit. What advice can you give women that do this? And additionally, what can women do to improve their heart health before a pregnancy to reduce the risk?
The number one response to that would be keep going, keep going to the doctor. That, I think, going once a year is fantastic. If we can keep that up, that's great. The other thing is, if you're thinking about getting pregnant, tell your doctor. I think your primary care physician, your gynecologist, whomever that physician is that you're going to go see, your nurse practitioner, midwife, that's something really important for them to know, that you are contemplating pregnancy. For us, that opens up a whole nother kind of pathway that we talk about. We start talking about preparing for pregnancy, talking about, birth control, and if you're on it, how to come off of it. Folic acid and vitamin supplementation, when to start that as you're preparing for pregnancy. And then one of the really important things that I see as a maternal fetal medicine specialist is that many mamas who come to me who have been on lifelong medications to treat whatever chronic, conditions that they have, think that they can't take any of those medications while they're pregnant, think that it's harmful for the pregnancy. And so come to me and have stopped all of their medications. That includes medications for high blood pressure, medications for diabetes, medications for anxiety and depression. And the truth of the matter is that almost every medication is safe in pregnancy. In fact, many medications are recommended to continue during pregnancy because the risk of uncontrolled disease is actually worse to the pregnancy and to the mom than the medication that they're taking. There's definitely tweaks that we would like to do. There's certain medications that we have better safety data on than other medications. And so sometimes if you're on one that we don't have a whole lot of data on, we will kind of change it and change it to a different form or a different type of medication. But the solution is definitely never to just take someone completely off of all of their medications, because instead of exposing babies to those medications, which actually may be safe, you're exposing baby at that point to uncontrolled or undertreated illness. And we definitely don't want that, because we know that that has real ramifications and real risks for both mom and baby. And I think, to kind of chime in on everything that's been said about ensuring that your cardiovascular health is in the right place before you even become pregnant is, again, to go in before you're pregnant and say, hey, I am thinking about having a baby. What can I do to prepare for that? And when should I start really kind of getting all of my ducks lined up in a row? That being said, about 50% of the time in this country, pregnancies are unplanned. And that's okay. I think if you are someone who has other medical conditions and surprise, you are pregnant, happens to the best of us, call us, we would still want to see you. And in that situation, I would, instead of kind of just stopping everything and stopping all the medications, hold and tell that doctor, I'm on these medications, I have these health conditions, I'm really worried about how this is going to impact my pregnancy. And I think all of us would work with you to get you in to see either Dr. Rodgers or myself or Dr. Lindley or another specialist sooner rather than later, to make sure that your cardiovascular health or any other health condition is being treated appropriately and also safely during pregnancy.
And this brings me to the next question for you, Dr. Kelly. How important is heart health during and after a pregnancy? And are the most common heart-related complications during or after pregnancy? And what are some signs that someone needs to look out for that?
Really good questions. So I like to think of pregnancy as a stress test on your body. So there are some physical changes and physiologic changes that happens to your body when you become pregnant. It makes sense, right? Your heart is just there to support you when you're not pregnant. But when you become pregnant, that heart has to work a lot harder, as does many other organs in the body, to support a whole nother baby. And we see throughout pregnancy, the amount of blood that your heart needs to pump at any given time really, really goes up, especially towards the end of pregnancy. And the amount of fluid that your body holds onto really, really goes up towards the end of pregnancy. And so to answer that question, I think heart health, we see it so commonly become a problem during pregnancy because that's one of the hardest working organs that you have that pregnancy puts the most strain on during the course of the pregnancy. That timing of when that typically happens, we really see these huge physical changes really start to happen at with conception, honestly. A lot of these changes start to happen with hormones and everything, but the most drastic change typically happens at the beginning of the third trimester, right around that 28-week mark. And the highest risk time for something to happen is actually right after delivery. And the reason for that is because after you have the baby, your body has all of this immense fluid that it's been holding onto for the pregnancy. There's probably a fair amount of bleeding that's happened, whether it's from a vaginal delivery or a C-section. It's a fair amount of blood loss that happens. And so what we see are these huge shifts of fluids throughout the body as your body kind of changes from this very pregnant state to back to your original non-pregnant state. And in that transition, that is a lot of change, really fast, sometimes a lot of change for your heart to have to, be able to compensate for. And if anybody has any sort of, cardiovascular issues or disease or predisposition to something, we really see that play out, really starting in the third trimester and a lot postpartum as well. It can be hard to figure out, is this like normal pregnancy or is this like heart stuff, right? I've had 3 kids myself. I am a physician, and I will say that during my own pregnancies, I was like, is this like normal for this to happen? All of these weird, there's a lot of stress on your body. You're carrying, sometimes 40, 50 extra pounds on top of you at the end of pregnancy, sometimes more. And it's a huge stress on your body. And you feel a lot of symptoms from that, right? And so what the most common sort of heart symptoms outside of pregnancy, you feel really short of breath. You can't get through a sentence because you're so short of breath. You know, all of a sudden you're walking and you're short of breath. Dizziness, swelling, you know, these are kind of typical things outside of pregnancy that we usually tell patients, like, oh, if you feel these signs, like, you know, go to a doctor. But a lot of these symptoms really overlap with normal pregnancy symptoms as well. And that can be really frustrating. I remember distinctly when I was pregnant that I like couldn't even get through a full sentence because I was so short and like out of breath. You know, shortness of breath is very common during pregnancy. It's partially because you have like a baby, sometimes multiple babies, pushing up and taking up some of that lung space. But one of the things that happens with the hormones of pregnancy is that it causes you to breathe at you know, more because you're trying to blow off all of that extra carbon dioxide for the baby as well. So that is actually a normal part of pregnancy. Swelling, as we all know, is a normal part of pregnancy. And dizziness and kind of all these fluid changes is a normal part of pregnancy. And so sometimes it can be really hard, especially towards the end of the third trimester, when you're like, is this actually normal pregnancy or is this something else weird going on? And I tell this to all of my patients, some of whom are really high risk, along with Dr. Lindley. We rather hear from you a million times during pregnancy about something weird or abnormal that's going on and be able to say, hey, let's check you out. Actually, this is normal. It's fine. This is kind of normal symptoms of pregnancy. We rather hear from you a million times and say that a million times to you than miss the one time that something is going on. And mom is, you know, you're a busy mom, you've got lots to do, and you're like, it's probably nothing. I'm gonna just shove this under the table. We rather hear if something weird is going on. We will help you triage and figure out if those symptoms are normal or not. But generally speaking, those would be kind of the most common symptoms of, you know, heart disease going on. Preeclampsia is one of the most common complications during pregnancy. We know a lot about preeclampsia, but it's a little bit of kind of like a vague disease still, despite it being around ever since women could get pregnant. You know, it's was referred to as toxemia in like the Victorian times. But essentially it's this inflammatory disorder that happens during pregnancy, and it causes basically all your blood vessels to like spasm throughout your body. And what we see from that is that your blood pressure really shoots up high from kind of that vasospasm. And in addition to that, organs in your body that have lots of blood pressure in them don't do so well when that's going on, and with the high blood pressure as well. So that includes things like your liver, your kidney, your brain, and also the placenta, which has lots of blood vessels in it. And so preeclampsia, when it gets bad, I like to tell my patients, you know, preeclampsia, like most of the time it's kind of what we call kind of this like simmering fire, campfire. You know, your blood pressure goes up, maybe we see a little bit of protein in the urine, but sometimes, and it's unpredictable, that simmering campfire really explodes and it becomes a forest fire. And that's when we really start seeing horrible, scary things happen to both mom and baby. And that's, you know, things like seizure, stroke, death, stillbirth, horrible things that are very, very serious as a side effect from preeclampsia. So that being one of the most common complications during pregnancy, if you have some other medical conditions that make you at higher risk for having preeclampsia, that's a conversation that you will be having with your obstetrician, hopefully as early as the first time you see them, because there's some strategies that we have in terms of, you know, lowering your risk for developing preeclampsia if you happen to be high risk, and also going through all of the signs and symptoms and cautionary sort of signs that you would see if we think that you're heading down that path of preeclampsia. So I guess we're kind of all saying still the same sort of concept, which is get into your doctor early, so that someone can kind of look at you globally, and also in the context of pregnancy to say, how do we maximize you and your baby's health with sort of the most common complications that can happen.
Wow, that was that was a lot of information, but I love the way that you explained everything. And I wish I had someone explain that to me, explain it like you did to me many years ago, because I experienced that with my first pregnancy, and it was very scary and very clinical, and no one had like the bedside manner that you just displayed. So thank you for sharing that with us, and also thank you for breaking it down and making it understandable, and not scary, because it was kind of said to me in a scary way back in the day. But I want to thank you all for your in-depth answers and to these questions. It's very important, and wanted you to share any final thoughts that you would like to leave our attendees with. And also attendees, if you have any final questions, please leave them in the Q&A.
Well, I just want to thank everybody for coming to listen today, and also Danielle for inviting us to participate. And thank you to Dr. Rodgers and Dr. Kelly for being such great partners across the spectrum of healthcare for women. I mean, I think the important things, as you've heard over and over, are just stay connected with your doctors. You know, don't be afraid to ask questions. Don't be afraid to talk about symptoms that you have. It's important to know what your individual risks are, to know what symptoms you need to be looking out for, because each person is different, you know, based on what your other medical conditions are, what your family's history is. You know, everybody's risk of developing cardiovascular disease is different, but the reality is that we're all at risk for it. And so it's important that we all kind of stay in tune with our own risk and stay plugged in with our doctors regularly so that we can try to prevent it.
Dr. Kelly?
I think I echo everything that Dr. Lindley said. You know, we like, if there is something that you're worried about with your own health, we like to kind of run towards the problem so we can address it head on, to prevent it from becoming a bigger problem in the future. So it takes a lot to scare us. We've seen some really complicated patients. And the truth of the matter is that most people can have a really healthy pregnancy and have a really great outcome for mom and baby. There's some extra work that we have to all put into the pregnancy to make that happen. But it's very rare that we tell a patient you're too sick to have a baby. That's very rare. For the most part, all of our mamas can, even if they're medically complicated, can have a fantastic and healthy pregnancy. And we, you know, would rather, like I said, run towards the problem and address them head on so that we get that healthy outcome rather than kind of hide behind it. So, you know, come to your doctors, engage with us. We really want that good outcome for both mom and baby.
Dr. Rodgers, any final words for our attendees?
Again, just everything that Dr. Kelly and Dr. Lindley said hits the nail on the head. And so just to kind of echo those comments, you know, come and see us, come have those conversations with us. We're here for you. And we really all are a team when it comes down to it. You know, I'm going to help link you up with any specialists you may need, like Dr. Kelly or Dr. Lindley. And don't feel like any topic is off limits. You know, we've talked a lot about pregnancy and obstetrics, but you know, a taboo topic is menopause and all the symptoms that come along with it. And then obviously the increased risk of heart disease as those hormones change. So let's talk about menopause. So feel free to come talk to your primary care about anything in particular, because we're going to be, you know, checking that blood pressure, doing those labs, keeping an eye on everything we need to watch to keep you as healthy as possible for as long as possible.
Thank you all for joining us for this important conversation about women's heart health. And know that no matter who you are or where you are, the American Heart Association is here to help you through these times. Their website, heart.org, has health resources you can share with your family. And we'd like to thank BJC Healthcare for your continued support. And thank you for everyone who has tuned in, who has joined us with this conversation. And thank you so much. And I hope it's been helpful for you all.